Improving access to mental health care is a top priority for the U.S. military, especially in the wake of 2 clusters of 8 suspected suicides involving Navy sailors in the past year.
On Capitol Hill today, lawmakers demanded answers. New at 5:30, Mike Gooding has more on the latest effort to protect our service members.
In the wake of 8 apparent sailor suicides in 10 months, the Navy's Surgeon General told lawmakers the issue of personnel taking their own lives and getting them the mental health care they need has gotten everyone's attention.
From the Secretary of Navy on down, we have taken this issue very seriously, as we have taken the general issue of mental health and suicide prevention seriously.
Rear Admiral Bruce Gillingham acknowledged that USS George Washington sailors faced an especially difficult climate as the ship was in the midst of a long-term overhaul.
GW certainly is an example of a challenging situation to be in a shipyard like that. But our sailors and Marines face challenging situations worldwide, and so developing force resilience is key.
Members of the Senate Appropriations Committee focused on a recent Defense Department Independent Commission's recommendations. One of them was to repeal a 2011 law that prevents military doctors from asking patients if they have firearms.
But as a rule, is it good medical practice for there to be gag orders on physicians as to what questions they can ask their patients?
I mean, anything that interferes with a good open discussion between the patient and a physician or a provider, not necessarily a physician, is not good for either of the two parties.
Mike Gooding, 13 News Now.
Earlier this month, the Navy released a 26-page playbook for mental health that officials said will not only provide commanders with an idea of what resources are available, but also help dispel any stigma around seeking help.